Welcome to an overview of the Exercise Rehabilitation and Visualization Study. My name is Dr. Mark Kramer and I'll be the program leader for this particular research project. Just to give a brief overview, in different contexts such as resistance training, injuries can be multifactorial. They might be due to faulty instruction, faulty movement mechanics, lack of body awareness, or incorrect or ambiguous cues. So if you have an expert or a clinician demonstrating a particular exercise, whether it is for rehabilitation or for performance, the question is, what does the athlete or the client particularly focus on? Where's their visual gaze directed in order to pick up the necessary visual cues to more accurately mimic the exercise that is being demonstrated? In a slightly different context, you might want to evaluate the difference between a novice and an expert when evaluating certain movements, such as a functional movement screen or an injury assessment, perhaps a movement evaluation, or even when evaluating and interpreting x-rays. What we can do is we can objectively quantify exactly where a particular individual is directing their gaze, and then that will be objectively quantified in terms of comparing novices versus experts or clinicians and their patients. To do this accurately, we use eye tracker technology, which allows for the analysis of gaze behavior in real or virtual environments, with specific applications in ergonomics, behavioral research, medical research, as well as sports and biomechanical research. Just to give a more concrete example, so here we have an individual that might be an expert or a clinician that is demonstrating an exercise. The question is, where's the novice or the client in this particular situation directing their gaze? What is it that they're particularly focusing on for how long in order to pick up visual cues that they will then use in order to replicate this exact same exercise? So we need various ways in which to quantify that. And then what we can do is we can use various cues, such as either internal cues or external cues, in order to direct them more effectively so that the discrepancy between expert and novice or clinician and client is much more accurate to minimize any potential risk of injury or to increase the effectiveness of the movement. This type of a research approach can either have a clinical or a performance track. On the clinical side, you might want to investigate normal movements, movements related to injury, movements related to rehabilitation, specific clinical assessments or tests, such as the functional movement screen, or to even compare novice versus expert biokineticist when it comes to evaluating some of the above-mentioned movements. From a performance point of view, you might want to look at trained versus untrained athletes or individuals, elite versus non-elite individuals, specific athletic maneuvers. So what happens or what do you look at when evaluating a jump or a change of direction task in order to more effectively complete those types of techniques? Or what is the difference between experienced and inexperienced coaches when they are evaluating a particular movement or sequence of events? The capacity for this particular research project, whether it's clinical or performance-based, can accompany one PhD student and two master's. If you have any specific questions or queries related to the project and would like to find out more information, my contact details are provided in the bottom right-hand corner of the screen. So you can either email me directly or follow my Twitter handle to ask any kind of questions that you might need. Thank you.